All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the shiny skin that you see today, this is my wife's latest cream invention. See, she tries them all on me. So here is me looking a little more shiny today. Okay, so let's see. How is everyone? Algebra Bean, hello. Doug, hello. Dr. Z, happy Monday back to you as well. I think we had a question. Did you write a book? So we have a question for you in Zoom. If you have written a book, we are requesting you to join us on Zoom and we have questions. DDS. Jim, hello, how are you doing? Christy, hello. Michelle, James Crooks, James Nguyen, Nipa, hello. Barbara, Lotus and Cat Bean, hello. Read, ready, aim, fire. And lots of folks. So hello, all cool beans. Who would get us started with the questions? Let's see. Michael says, hello, fellow geeks. Hello, Michael, how are you? Suzanne says, hello, back to you. Hello, all. Bambi, hello, how are you? So here is a question. Lynn says, to have natural immunity, do you have to contract COVID? We are constantly being hit with viruses, and this is what makes our immune system strong, fighting them off, correct? That is correct. But our immune system is very, very sharp, that usually it knows who it attacked and it develops immunity against that. There is some cross immunity that develops, but we don't have any other virus so far providing us immunity for SARS-CoV-2. So that means if you say natural immunity, which I'm assuming you mean immunity without a vaccine, then that will be by infection. And I do not suggest getting an infection because we have no idea who dies. Okay, so Jody, hello, how are you? Roman, hello, how are you? James says, question, best city you visited for work besides Palo Alto? So of course I love California, that's why I moved here. In addition to this, I loved Turkey. So Istanbul, Turkey, I loved that. I have a so now that you asked this question, I was thinking about it once a few days ago. I was thinking of going back to another international tour. I used to go for international tours to do speaking engagements. So a few days ago, I was thinking about it and I was saying, I have to make sure that I don't take any flight that stops over Germany. We have, every time we stopped over Germany en route to any other place, if we stopped in Germany, they always took me and my wife out for a randomly selected check, and then they would take us to some room separate, and they would look up our documents and interrogate us and do a lots of a few hours of discussions, and then they would always say you can go, but that is a uh, not the most comfortable experience. So I was thinking, I was talking with my wife to say, hey, this time when we go, we have to make sure that we don't stop in. So even if it is just a stopover, meaning the flight landed, some people are deboarded, and then the flight has to fly again, they would get us out as well and say, these two guys, can you come down? Me and my wife, every time. James Nguyen says, that happened to me in my first flight, but for like 2 minutes. No, so they usually in Germany. This is my experience only in Germany, no other country, where they would bring us to a place, and the folks are geared up, and they have those huge jackets and guns, and then they would make you sit down there for an hour or so. Then there is a place where they would bring you in. It's scary. Okay, so Gold Country Russ says, Dr. Bean, did you review the video of the three German doctors? No, I have not. Um, Amy says, your thoughts on T detect? I'm having the test done, and if it's negative, then Moderna 3 months apart. Yeah, so T detect should be able to pick up those circulating T memory cells and help us understand them. So that is a good test. So John Govier says, how effective is the vaccine against the Delta variant? We did this a few days ago, few weeks ago. The vaccine one dose efficacy has dropped drastically. But after the second dose, the efficacy had gone back up, and it is lesser than what was seen in the trial, but still it is significantly up. Somebody said to me that the latest data shows that the efficacy is reduced further. I have to look at the latest data. So maybe we'll talk about it tomorrow or day after. Barbara says, I think I need a lecture on coagulation factors. So complex. Barbara, I actually did a talk about it. Did you watch that? And if you wanted, I could do it once more. Augie says, shouldn't prednisone cause apoptosis, rate spike protein? It's a steroid. So steroid's job is to suppress the immune system or reduce the function of the immune system, which could lead to apoptosis as well. The question is, where would that spike protein S1 portion, I'm guessing the monocyte, where would that go? We have seen that the long haulers do respond to steroids. So it is possible that this mechanism is working, but in some cases it may not be. Wanda Dell says, I believe I had COVID 19 in February 2020. Results from test last week said no, I have been exposed to COVID 19 5 different times, even quarantined with my daughter for 12 days, but never got the virus. That's interesting. What test they did? Was that a T detect or the other tests? So Mutila says, from Afghanistan, I want to watch your videos freely. You can watch my videos freely. This is free. Everything is on YouTube, the COVID videos. There are some videos that are not about COVID or about other topics that are not free, but these are all free. Bob Cipolla says, would it be worthwhile for an individual to have antibody titers tested, thus possibly avoiding unnecessary revaccination if titers are sufficient? Yes. The question is this: many times they're simply saying, hey, you need to be vaccinated and show us that card. Otherwise, in my opinion, the people who have become naturally infected and recovered, we should leave them alone for vaccination. Why to expose them again to this antigen and the adjuvants in the vaccine? This does not mean I'm anti-vaxxer. I have had the vaccine, my family has the vaccine. But this is just a wise thing to do. This is a logical thing to do, that if somebody had the infection, why are we pushing them to take a vaccine? And again, in the last discussion, the criteria has to be the same, that if somebody doesn't have the immune system correctly functioning, or they are diabetic, they're uncontrolled diabetic, and so on. So there are reasons to have another dose, but just generally close your eyes and say you got to have a vaccine, that's not correct. Okay, Ruth says, 5 years ago my doctor said to me that I have too much antibodies. What does that mean? Can I have the vaccine? So please talk with the doctor. I do not know what do they mean. It is possible that in some cases your B cells continue to make more antibodies for longer period of time, or they just make more antibodies. There are conditions. So I cannot, without knowing the history, the labs, without having you being my patient, I cannot advise you. But I don't think that these are the kind of situations to take vaccine or not to take vaccine, but talk with your doctor. He should be able to know exactly how much more antibodies do you have, why are they increased, and then advise you to take the vaccine or not. Zan Solo says there's an article about sumac as potential cure for COVID. Very good. I have not read it. I can. Questions. So P. King says, is the herd immunity theory out of the window? Actually, very good question. I'm going to share my screen to quickly explain what is going on with the herd immunity. The herd immunity theory is actually not out of the window. The basic concept is simple. The concept was that the herd immunity equals mathematically R naught, reproductive number, minus 1 divided by R naught. So when the Wuhan virus was out, we used to say that reproductive number mostly was between 2.5 to 3. So let's use 3 for my ease. 3 minus 1 divided by 3. That is 2/3. So we said 2/3 of the people, when they are vaccinated, then the transmission of the virus will be from one person to another one person. And when this one person has recovered, it has only transmitted to one other person. And we say this is the disease has become stable in the society. It is not spreading. However, with Delta, the R naught has increased. So let's say now the R naught is 9. That means the herd immunity need is 9 minus 1 divided by 9, which is 8/9. So you can see that already the number has gone up. That is what is happening. So the theory is not out of the window. The math is not out of the window. The variants are not has changed. CJ says, how's your wife doing? Does she take ivermectin? My wife does not take ivermectin. When I really, really insist, she does, but normally she doesn't. And she's doing well. For a few days now, she has been doing her general things and she's been doing well. So it is episodic. But this is much different compared to where she was before. So thank you for asking. Michael says, is there any issue with either vaccines or Loofy Mectin with paroxysmal atrial fibrillation? Also, is it okay to try small dose Loofy Mectin to test effects before starting protocol? So I actually always ask my patients who I may be doing telemedicine with and they may not be close to me. I ask them to take a tiny dose and see how does that go before you keep ramping it up. So that is a wise thing anyways. And then there is no known, there is nothing known for the ivermectin with the atrial fibrillation. Now vaccines, ideally paroxysmal atrial fibrillation has nothing to do with the inflammation. It is just sometimes part of an atrial tissue starts creating pulses. But can we guarantee that vaccine will not do it? That is the answer I do not know. I hope that they have done during this trial this thing. My request to you will be to ask when you go for vaccination over there, the doctor who is sitting there, you can ask them. And if they say, I do not know, then you can make your vaccine pending till you find this answer. I can look for that answer as well. But I do not know specifically about this condition. Audrey says, Dr. Been, can an mRNA vaccine cause or worsen hypertension? If so, how long would the effect last? So the vaccine cannot directly cause or lower the hypertension, but it can cause inflammation, it can cause side effects that in turn can cause anxiety or anxiousness or pain that can change the blood pressure. If the long COVID occurs, then there could be dysregularity of the cardiac tissue and cardiac function, which can then change the blood pressure. Some people actually develop postural hypertension as well. So if you are experiencing any such thing, please talk with your doctor immediately. They have to see why this is happening. Soma says, why do some vaccines have greater side effects in first but some have in second? Will adenovirus second dose be safe if first cause no adverse issues? So generally, if the first, usually the first dose is the one that causes, for example, clotting or cardiac issues, although second doses have known to do that too, but lesser. So that is one. Secondly, it is not that the some vaccines have first dose as more side effect or the second with less. It is the people. Some people respond more to the first dose and some people respond more to the second dose. It's not the vaccine, it's the person's immune response. John Ria says, have we already discussed the importance and mechanism of anti-androgen inhibitors? Also the TMPRSS2 pathway. So we have done TMPRSS2 pathway many times. Last year, a year ago, in the there are two talks. One was bromhexin, and then there was a separate study about the TMPRSS2. So we've done that. The first part, anti-androgen, that is what we have not done. So I can look into that. So Kelly Holmes says, the spike protein that is harmful and there is no immunity without vitamin D, why aren't we prioritizing vitamin D supplementation at 4,000 IU dailies? So generally to your question about the vitamin D, yes, we should. And I have been saying this, that our, what is this, our CDCs and FDAs and NIH should have been putting up the ads all the time to say, hey guys, keep your vitamin D levels up. I do not think I agree with the rest of the statement, but vitamin D question is correct, and I do not know why they don't do it. Ziaul Haque says, is previous dengue infection has a beneficiary effect on COVID? No, I don't think there is any cross reactivity. Plant Kingdom says, may we have a protocol for the jabs, please? Plant Kingdom, I have to work with Rima to finalize it. So, Rima, if you are hearing, we need to work on the questions to finalize this and present it to the cool beans. So, give us a few more days, Plant Kingdom. Nipa Gandhi is here. Hey, Nipa. Any effect of blood transfusion or donation for vaccinated or not? So, the vaccinated person, depending upon when did they get vaccinated, one dose, two dose, they may have antibodies in their blood. They may have memory T and B cells in their blood. These memory B and T cells are not very useful, but the antibodies are actually useful for the person who got the transfusion. That is just like convalescent plasma, although the concentration is not as great as convalescent plasma. So, effective blood transfusion or donation for vaccinated or not. So, no issues. So, Anonymous says, does COVID cause histamine intolerance? Do you know the reason why people get sensitive or doesn't process histamine well? So we had Dr. Fareed Jalali. So if you can watch that video, I think it was more than an hour long, very interesting discussion. And he talked a lot about how COVID causes histamine and related substances dysregulation. and how to manage that. So yes, it is possible. Uh, Ratis says, can someone help? Ratis, hope you're okay. What help are you looking for? Has COVID caused hair loss? Yes. So there are reports of COVID causing hair loss. Paulette Rose says, Dear Dr. Been, I'd like to know if transient dizziness is a common side effect with ivermectin. Yes. I have experienced that for about an hour after taking it and then it dissipates. Thank you. Yes. And there have been at least one more person who has taken ivermectin and reported that I became dizzy. So, yes. And the care to take is that this dizziness can cause a person to fall. So, if this is something that you experience, and please don't take it or take it in lower dose or be very careful when you take it because it can cause a person to fall. And sometimes falls can be fatal. Horoticus says, Dr. Bean, will vaccinated breakthrough cases develop the N protein antibodies after infection? Will vaccinated breakthrough cases develop the N protein antibodies, so neutralizing antibodies? Yes, yes. They already have them and they would make more of them. You are very welcome. So Robin Foley says, ivermectin for prophylaxis, early treatment in people with ulcerative colitis. What if being treated with prednisolone and or biologics? Separate things. Ivermectin can cause GIT upset. So that means if somebody already has a GIT upset, on top of that, if we add ivermectin, that can become bad. So that means talk with the doctor, start with a smaller dose, see what is the effect, and with the doctor's advice, then you can increase the dose. That is how I will do it if I needed it. So Ratty says, hello, can someone help or redirect how I may get ivermectin? I've gone to FLCC site, but it is mainly for the states. I need a prescription. So Rattis, there is, so I'm assuming with your question that you are looking for non-United States site. So if you go to FLCCC, there is another link for the existence.com. I always forget the existence.com's URL. So I always go here to find it. So if you go in here, then where is it? There was a link here. I can't see that link. COVID-19 meta-analysis. I'm so sorry that link was here. I cannot find it. So I'll have to figure it out. And it is existence, but the spellings are the ones that always escape me. So if you are from an international location, can you tweet at me and I can find that URL and tweet back at you? Rahul says, I have relapsing remitting multiple sclerosis. I am stable since 5 years on Evonex interferons. No relapse. Very good. Can I have messenger RNA vaccine? Will it trigger autoimmune response? So Rahul, that is a problem. We actually do not know who will have the autoimmune response. Um, So what you should do this is you should sit down with the doctor and say, do I need to actively have the immune response modulated by using, let's say, some medicines, and then take the vaccine? There have been studies that I have shared where a vaccine can be given in smaller doses and that would cause less effects. So you will have to talk with the doctor. I don't want you to accidentally get a relapse. At the same time, if you're looking for vaccine and you're hoping to protect, then please do talk with your doctor. And the reason when I say talk with your doctor, one, I should not advise you here. Secondly, I do not know the history of the person. I do not know the labs. I do not know the history. I do not know how your progression has been. So that is why it is important to sit down with the doctor. Sameena says, please, if pregnant women had Covax vaccine, 2 jabs, what will be the response to baby? So actually, if I very quickly share this, so if a pregnant woman has gotten a vaccine, then what will happen is that so they will transmit. So let's say here is the baby. They would transmit to the baby IgG, and that would actually protect the baby when the baby is born. After the birth, when they are um, lactating, and if baby is nursing on mother's milk, then baby would have IgG plus IgA as well. They both are protective for the child. So there is no harm if a woman has become vaccinated. There is no harm to her child because IgG is actually very protective. And you know that women transmit other IgGs as well through placenta. So they transmit the um, what is that? The immunity. Roman, thank you very much. So the cool bean who just asked this question before, EXSTNC. So let me actually go and see if I can go there. EXSTNC.com. So if you go here, I believe they have a list. Here is a directory. So I do not know which country you're from, but this is a directory of various countries. Hopefully you can find your country here and then request ivermectin. Thank you very much, Roman. Kelly Holmes says, Loofy, safe and effective treatment for pregnant women? No. So it can cross the placenta, it can end up in baby, it can then cross the being built blood-brain barrier and go to baby's brain and cause damage. So no, it is contraindicated. So MSNBC says, thinking of 3 relatives. If someone gets COVID, no vaccine, would one treat with ivermectin or go in for monoclonal antibodies infusion, which higher rate of stopping? They are not young. So of course ivermectin is interesting, but in case you have access to monoclonal or polyclonal, I would add that for sure. That would be extra benefit. Those antibodies are going to come in and mop up the antigen. That would be awesome. Sabgal Gal says, just started following you, so you believe these vaccines are safe? Good question. I don't think they are safe for everyone. At the same time, um, for a majority, they are working okay. What scares me from them is that some people get, of course, we know that there are severe side effects in rare cases that um, clotting can occur. People have died of that. Cardiac inflammation can occur. People have died of that. Then there are severe side effects that were seen in Netherlands in fragile and old population or hospice care patients who died of that. But then a majority are okay. What further worries me is the long COVID or long COVID like symptoms that develop because of the vaccines as well. So that means it's not entirely black and white. Uh, Even today, I was thinking about this and I was thinking CDC's, NIH, FDA, are they not getting vaccinated? Are their relatives not getting vaccinated? Are they not seeing this? Why are they not talking about it? That, hey, there is a protocol to have for who should get the vaccine, which kind of vaccine, what protective things to do with the vaccine. I would definitely favor the vaccine over the actual infection. I am a pro vax, all of my family is vaccinated. I would never stop anyone from taking a vaccine, but there should be a preparation. I'm also not that hidden anti vax who says, I am actually a pro vax, but for this vaccination, I'm an anti vax. I believe that this vaccine is useful. One just has to figure out how to do it in a more protected way. And that is a discussion with your doctor. Nick Blanchard says, if adenovirus vaccines are integrating into DNA, as you speculated before, and that is causing the longer immune response after J&J vaccine, what might be the other effects of such a situation? So the most important effect is going to be this, that if they continue to make spike protein, then our immune system would continue to respond to them. Eventually these cells would be cleared out because our immune system don't just let them sit around and do the bad thing. But at least this pulse of continually making spike protein then not making, at least J&J says it can continue for months. Eventually those cells are removed. M. Gregory says, why is MSNBC mainstream media getting their info here but not reporting it? I think the so this is, I mean, my guess is as good as yours. They have their biases, they have their blind spots, then they have their leanings, they have their experts, they have it's not true journalism. That's what I learned. Just like these discussions, you would see that anybody who doesn't like me saying about talking about vaccine, they will put a comment and say this is not true medicine. I actually saw a comment. I usually nowadays don't read the comments because there are just all kinds of comments, but there was a person who wrote this comment that you are not a doctor, why why are you being a YouTube doctor? And I was surprised, how do you say I'm not a doctor? So there are just like people are saying medicine is not doing well, we just saw that journalism is not doing well. The question is, which is causing more harm? Journalism is causing a lot of harm as well by censoring, suppressing, manipulating the information, which is then manipulating the people. Westfield says, good answer, Dr. Been. Thank you very much. Semi White says, could you please have Dr. Simone Gold on here to her? I generally don't agree with her thoughts. So having her, I avoid those guests who I have to bring in and then have to hold myself to let them have a voice. Somebody criticized me for one of the guests who was saying things that I don't agree with, and they were saying, now you're not talking. So they thought that I was intimidated by the person, and that's why I was not saying anything. But I find it, I'm not a journalist. This is not journalism here. Um, so I find it odd to first request someone to come in, and then when they are presenting their case, then start interrupting them and saying, no, you're wrong. So if I have to do that, I can do that separately. Why to do it here? If I have requested them to join us, then I should be sincere in getting their message to you and not become an obstacle in the way. This is why I don't challenge such folks, but at the same time, then I don't invite them. Paulette says, in order to minimize the side effect of ivermectin, can I divide the dose? And yes, you can. Yes, I think that yeah, the efficacy would stay, and yes, you can. Again, not an advice. This is your doctor to discuss, but generally, from a dose point of view, it can be done. Amy is correct. Journalists are supposed to expose rich and powerful. Unfortunately, they're now working for them instead. That's correct. Journalists are not doing journalism. Bambi, how's everything? Hopefully, UK is doing well. You are doing well. Um, Carlos Ortiz says, can lufimectin spike heart rate? After taking zero point 0.3 per kilogram for third in a row after travel, heart rate spiked to 130, feeling good otherwise. We'll have ER to ER. Would head to ER, though I really don't want to. It may be causing that by prolonging the QR interval. So let me see. A QT interval. Ivermectin QT interval. So there is a 2016 study. I'm just opening it, so I do not know exactly what their message is in here. But let's see. Ivermectin is a broad spectrum antiparasitic endectocide clinically used for onchocerciasis and lymphatic filariasis. Control at single dose of 150 to 200. It also shortens the lifespan of mosquitoes. However, the effect after 150 to 200 microgram oral dose is short-lived. Modeling suggests higher doses with prolonged mosquito effect are needed to make ivermectin has a widespread this methods results. No, so I don't know. Conclusion. Let's see. No, so I'll have to do some research. I did not know that it could do it, but who knows? Maybe. See, due to their potential to cause QT interval, ivermectin drug induction, pharma's and safety of information. If I go to QT, prolonged QT Torsades, prolonged QT ventricular fibrillation may occur. Patient should be careful monitoring acute renal failure. So, which drug is this one? This is some other drug, not ivermectin. So I'll have to do some research. I might start wasting your time here. Um, so do me a favor, Carlos. Can you please tweet that at me and I can, or put it in Patreon or Discord? And of course, at this time, if you have it, please do talk with emergency as well. I was diagnosed with fibromyalgia decades ago, taking lufimectin prophylactically and J&J vaccinated. Lufimectin has with fibro symptoms. Is that possible? Yes, because even with the fibro symptoms, I think what we have been doing is medicine. Is that we have been taking a lot of chronic diseases and wrapping them and lumping them together in fibromyalgia. So there may be other inflammatory situations which ivermectin helps with. So yes, it can actually help with that. And I actually believe that is a good outcome of this pandemic. Unfortunately, there is so much damage. However, we have also found that ivermectin like medicines can help. Paulette, thank you very much for the super chat. Um, Bambi, correct. Dr. Fareed Jalali. Danilo says, is there any way to predict upcoming variants? No, really. I mean, these, as you're saying, enthalpy or entropy could be looked at, but exactly which way the variant is going to go is its interaction with the human body, and what part is killed and what part is left. It's an interesting question. Good research question, actually. Janet says, I got my second Pfizer after starting Keytruda. Would that have affected my response to the Pfizer shot? In theory, no. Should be okay. Danilo, your question was good. Luffy's here. MSNBC says monoclonal antibody infusion or treat at home with ivermectin, which with highest success, older person. So there is no data. All of my patients who were mostly in the older age, they worked and responded very well to ivermectin. Having said that, I have one case, my class fellow's mother, who was fully vaccinated. I started her on, got the infection. I started her on high dose ivermectin, and she did not make it, and it didn't work. So, in my opinion, getting the antibodies is also important because ivermectin is not 100%. Christine says, hey Luffy, miss a guy, he's too quiet. Let me see if he's here. I'll bring him on. Hey Luffy, give me a second. I'm going to try to bring him. Luffy. As is usual, Luffy will not let me hold him if I go and find him. It's only when he wants to. Westfield says we need hold music. Yes, I think I should put some sort of a music here to play. Um, yes, he was outside. He came back in. Let's see more questions. Hi, Dr. Been. Does the mRNA vaccine protect teens from getting the inflammation disease after COVID? It does. The only important thing to keep in mind is that it can cause in men, in boys, it can cause cardiac inflammation. So just be very careful. It is rare, but it can happen. Dolly says, can Loofy Mectin cause liver failure if taken? No. Liver failure, one chance, one case of liver failure was observed with 3.75 billion doses of Loofy Mectin. And even that one was an association. And for me, there was a funny tweet a few days ago. Someone from Malaysia, a doctor, tweeted their patient's LFTs, liver function tests, and said, this patient, before coming to me, was taking ivermectin, and look at their LFTs, and they are in a liver failure. This is the toxicity of ivermectin. And for me, this was interesting that Dr. Fareed Jalali, who is usually very much against ivermectin, he retweeted that and said, as much as I don't like ivermectin, these LFT numbers are not indicative of ivermectin damage. They are of hypotensive damage or acute shock damage. So there is rumors out there for vaccines. There are rumors for ivermectin. There are rumors. There are just all kinds of, and even doctors are saying these things. 9 to 5 Gaming says, question, if you are waiting till the 14 days before fully vaccinated, would ivermectin hurt your body making antibodies? No. So I have discussed this many times, not at all. So Teresa Huber says, I see Merck is trying to develop a pill of a different medicine to fight COVID. Molnupiravir, I believe it is an RDRP disruptor, which ivermectin's one function is RDRP disruption as well. Jody says, hypothetically, would 3 days of 30 milligram prednisolone need to be weaned or can quick stop? Son did get some chest pain from vax, but prep stopped it and now feels better. So I have always tapered regardless. I have never taken a chance, and that is because I'm a chicken for my patients. I don't take a risk with my patients. So if you would ask me, I would always ask for a tapering. This is why FLCCC has my tapering schedule on it. All the doses are low. So this is a controversial topic. Controversial meaning there are some doctors who say no need, and then there are some doctors like me who say always taper. Then there are formulas as well, that if the dose is this, then you taper it this way. That means you can go with his doctor's advice. If you ask me, I would always taper. Vanazuzu says, Vanazuzu, can you say something to reassure people that vaccines will not cause ADE when vaccine effectiveness wears off over time, or with new variants? Some people are worried about this. I have done this discussion. There are 5 mechanisms of ADE. We have not seen them. There is a latest study which, unfortunately, some um, gentleman-looking doctors continue to promote them as proof of ADE, and that I have read it again and again. The exact statement in there, actually, even today I was discussing that with someone, so it's here in my WhatsApp. So give me a second. I'm going to read the statement. It says, so I sent it out so I can read it here. So from that study, I wrote to someone, I said, the word may tells that nothing is proven. And the statement is, this stabilizing mechanism may facilitate the conformational change that induces the demasking of the receptor binding domain. May. And these guys picked up this simulation where after the simulation, they said it may. Ivermectin has a simulation as well. The S1 protein binding is a simulation of ivermectin. But it is in the simulation, it actually binds. Here, with the simulation, they say it may bind. And then they say it may cause ADE. And then the people come out on Twitter and say, this is causing ADE. See, we told you that we would have ADE. So there is no such mechanism yet. It almost looks to me that some folks are just sitting somewhere praying that this causes ADE and then we can be proven right. There is no such thing yet. I am going to go over that study just to be able to discuss it. But you can imagine every 1 hour, somebody sends me that study and says ADE. And this is because people on Twitter are misrepresenting it. I cannot imagine that they can actually do this, that it is written in there, right in front of us, that the authors are saying it may, even after the simulation, they still have a conjecture. And then this person links to it and says, here is the AD. There are folks like that as well amongst us. Xavier Money says, have you spoken to Dr. Robert Malone? No. Um, Soma and Srijay Ghosh says, what are the hazards of beta propiolactone in inactivating viral vaccine if the vaccine goes in cell or not? Hazards of beta propiolactone? I have no idea what your question is. Um, so the inactivated virus ideally does not get into the cell. Instead, it is eaten up by macrophages and neutrophils and dendritic cells, and then it is presented to the immune system. It doesn't go into the cell like messenger RNA particle goes. So Teresa Huber says, would ivermectin be good for those students returning to school? Is anyone doing a clinical trial on school children who aren't vaccinated? I am sure that some data is being collected and trials are happening. I am not aware of it. And then ivermectin has been used for children for deworming. The only thing is, I've always repeated it, not with this frequency. So if you look at FLCCC, they recommend prophylaxis with it. They actually have increased the dose, which I don't agree with the increased dose, but I'm sure that they have some, they're seeing some things which are making them increase it. Everjo says, I have COVID since Friday night. I have been taking ivermectin once a week and now every day. I doubled it, started Z-Pack. Oh, sorry, Z-Pack. Today I feel much better by 50%. Very good. Very good. Wishing and praying that you become okay very soon. Denise says that some very intelligent people in my circle believe ADE for some viruses has been proven. So it can occur for some viruses, even in humans. I think dengue virus can cause ADE, that is proven. For SARS-CoV-2, it is a fortunate thing. I don't know why are we with SARS-CoV-2 waiting for some disasters to happen. We should let it be out, be removed from our society, or become humanized instead of continuously putting some spells on it to say now it's going to become bad. For SARS-CoV-2, it is not yet proven. These studies, these simulations, if they said we have seen this in simulation and we can now prove that it does this, and then we can prove that this would cause infectivity, even then the answer to that is actually very simple. So what if it causes infectivity? Because our body knows how to handle it, and in some cases people do not know how to handle it. In those folks who do not know how to handle it, they don't handle it regardless. And those who can handle it, does it matter? So what they're saying is this: let's assume, I'm going to share my screen and draw it. This is what I was thinking today, and I was saying, what a bad way to mislead people. Let's say here is a cell. This cell has a number of ACE2 on it. Number of ACE2s. The virus does not use all ACE2s. It does not use all ACE2s. If the virus connected with all ACE2s on all cells will die, or will have serious trouble right away. Right away. Virus does not even use all the gates available to enter the cell. And here are the doctors, researchers who are coming up and saying, we think that when the antibody will connect with the virus antigen, then this antibody will connect on the surface of a macrophage or another cell. This would cause the NTD, N-terminal domain, to attach to the cell and allow somehow the cell fusion. This whole thing is a theory, and cause infection. And what they're saying is that this is another route of infection. Fine. How many more cells will get infected, or how many, even this virus is not taking all the cells with the ACE2. So then what if 10 more viruses entered this cell? This cell is doomed anyways. So if the infection actually did occur, so if our immune system knows how to handle it, we will handle it. And unfortunately, in some cases, we will not handle it and will die. And that could be me as well. Nobody knows who. So this enhanced infectivity. So again, I'm going to just read it for you. This stabilizing mechanism may facilitate the conformational change that induces the demasking of the receptor binding domain. Do you know what they're saying? Is, look at this. How interesting is this statement? They're saying, here is the some cell. This is antibody. Antibody is connected with the antigen. Let's say it is captured a pathogen, SARS-CoV-2. This change here, when the antibody is connected to a cell, or maybe not even connected to a cell, let's say separate, just the binding of the antigen and the virus, they're saying, now check this out. They're saying that this connection here, the magnetic forces here, will cause this domain to become demasked, to become open, to bind to ACE2. They're not even talking about this mechanism that I said. They are talking about, then the virus still has to connect to an ACE2 to get into the cell. So what? Virus normally uses its ACE2 and gets into the cell. What they're trying to say is, there will be some viruses that will not get into the cell otherwise, but when the antibody is present, it would open up their their spikes, unmask them, and now they will be able to get into the cell. And that is where the hell has broken loose. First, SARS-CoV-2 is not sitting around to say, you know what, in many cases, I'm just not going to do anything. I'm just going to sit here. And number two, SARS-CoV-2 is generally going to bind with ACE2 with very high affinity, and that does unmask its system anyways. And number three, even if you help it unmask its domain and it binds better, so what? That is what it does. And so it would infect. The rest of infection and our response is still the same. More load, Delta does more load anyways. So what? Delta has gotten R naught increased so much because of increased viral load. Even then, Delta, our societies and our systems are handling it. So I don't know what they continue to do these things for, but anyways, that's happening. Jack says ADE may occur in people receiving vaccines based on the original Wuhan strain spike sequence, either mRNA or viral, and then exposed to a Delta variant. That's a pretty big may. And not only just that may, what they are saying is, this is the only thing our body would do. They are assuming that our body doesn't know anything else to do. Our macrophages and our neutrophils and our dendritic cells will not eat up this stupid virus. They're saying that once the complex, we the antibody, I have done this discussion before, so it kind of looks strange if I become triggered with this again and again. But when a pathogen is connected to an antibody, there is another set of biological functions that trigger to kill this pathogen. For example, this complex is eaten up by macrophages. For example, this pathogen, this antibody would cause complement activation, which would destroy this by settling on it. How much will be the chance for this one complex to cause the virus spike proteins to open up to bind with ACE2, and this virus is not becoming a target of antibody caused complement destruction or antibody antigen complex eaten up by the macrophages. Let me actually show you here. So antibody antigen complex and macrophage, you could add clearance. Macrophage interaction with antibodies and antigen complexes. This is actually macrophage's function, to eat up these complexes. What happens is our antibodies, they're such a cute things. They come in, they bind with the antigen, and they're tumbling around. And in that process, they're activating complement, which would destroy this pathogen. In that process, they're tumbling with this, and then the macrophage would come and attach with it and eat them up and destroy them. So these folks are saying all that would not happen, and just this whole thing would work out. I am afraid that when actually this would happen, then what would happen if this happened? The Truth Free says, why is the Lambda variant resistant to vaccines? No, it is not. And I have done a discussion called All About Lambda Virus. Please watch that. It is useful. It's not. CJ, this is a very good question. So I don't have the answer for this from a research or study point of view, but we know that ivermectin can bind to S1. We also know that after using ivermectin in long haulers, they improve. So these may be anecdotal things to say it can help. Maybe it is helping in some other way, but this could be one way. Eckhart Troll says, immune system is all we have. Without it, we all would die. Yeah, immune system, it's difficult for us to survive without it. And then there are doctors who actually say the innate arm will be depleted. How could innate arm be depleted and we still live? So, Nick, did you get a chance to check out the paper I sent you regarding RBD? I think I received it. I haven't yet seen it. This weekend, I went to San Francisco with my wife, and so I just wasted time this weekend. Okay. Eckhart Troll says, I love it when you get triggered. I get triggered in this one. So AD is a fair enough discussion to have. What I get triggered is that then there are people who pick up this and continue to hammer and tell the people this is happening. And I feel bad about them doing it. Svetlana says, Dr. Bean, your wife is time. Absolutely. So I was not talking about time with her being wasted. I wasted a bunch of other time as well. I lounged around. I love space, age, movies, or these drama series. So after 16 months of doing these talks, this was the first weekend that I started watching Expanse. I had watched it again. So something very funny about me. I can never remember any video that I watch, any movie that I watch. You can have me watch a movie 10 times, and every time I'll watch it and I'll say, wow, that is an awesome movie, and I'll forget the next day, and you can have me watch it again as it was the first time I watched it. So, according to my wife, I have actually seen 2 seasons of Expanse with her. I don't remember it. So she said there are new seasons as well. She watched them. So I started watching them. So I watched a complete 1.5 season of Expanse as well. So I did a bunch of things that I have not done for 16 months. M. Roberts says sleep watching. M. Roberts, this is how I am. For every video, every movie, whatever language, whatever movie, drama series, if given a few days, I totally forget it, and then I can just keep watching it. If you have watched that movie, First 50 Dates, where the person wakes up every day and forgets, and then they fall in love all over again. I have that affair with movies that I just forget them. So, Trip says, how possible it is to get COVID after one dose of AstraZeneca 5 months back and COVID 6 months back? So, honestly, I can't say how possible or not possible it is, but somebody who got COVID and then AstraZeneca as well, imagine AstraZeneca acted as a booster. So, generally, they should be okay. Yeah. I love Expanse. I have watched a couple of other um, space age, space odysseys, which I love. I, as usual, I forget their names. I forget them, but I just know that I love this one. I love Stargate. I love Star Trek, but Star Wars, of course, I have the whole collection. But I generally just watch them and I forget them. I can watch Star Wars again and again because I forget them, not because they are so fun to watch again and again. I just forget them and I watch them. I don't even remember which one is the first and which one is second and which is third. You can have me watch in whichever order you and I'll watch it. M MSNBC says hypothetical monoclonal antibody infusion or treat at home, which highest success? So MSNBC, I responded that I will always give antibodies as well. I would take both. Deb says any part of the protocol hypothyroid. Yes, ivermectin can cause further deterioration for hypothyroid. Doug says 2001. Doug, is that a movie or if that is a movie, I'll watch. If I have already watched, I should have forgotten. Ambal says, did you need your vaccine passport in San Francisco? So we went to there is a restaurant called Ala Turca. It's Turkish food. They didn't ask us for the vaccine passport. Laurie says, you deserve a weekend with your wife. Your brain must have been confused. It was not reading studies. Yes, it is actually. I love going to San Francisco. I love San Francisco. The San Francisco is the reason I moved to California. Um, so it's fun. It's actually after 15, 16 months of these daily talks that now I have started to normalize some parts of my life. Mark says, watch Outbreak. It teaches us that fuel air bombs are useful in an epidemic. I would. And if I have already watched it, then I would still watch it again like a new movie. Augie says, Incel DX expensive. Augie, what I have heard, because I don't have any financial or commercial things, I keep myself isolated from these parts. What I've heard is that it is $400 for one test. Barbara, that's so funny. Dr. Been can literally memorize textbooks, yet doesn't recall seeing films. Barbara, there are two issues that I have. One is I don't remember faces. I am so bad with the faces that, and people have diagnosed me in all ways. Some people say you don't take interest in people, that's why you don't remember their face. There are other diagnoses as well. It is so bad that I went to a friend and he had another friend over. And then they said, how about we all go to mall together? And we said, yeah, sure. So three, four of us men, the wife stayed at home. Three, four of us sat down in a car. I sat behind the friend, and his friend sat in the front of the car, and we went to some mall. Now we are shopping there. And of course, this person is with my friend, and they are shopping as well. And I'm looking at this person, the friend's guest, and I'm thinking, I have seen this person somewhere. I just came with that person in the car, and I'm looking at him and I'm saying, I've seen him somewhere. Where have I seen him? And thank God I didn't ask him that, hey, sir, where have I seen you? So I have this problem. Oh, I love Blade Runner. So I remember Blade Runner. I love it. I just don't remember. So if you said, hey, watch Blade Runner again today, I'll watch it. Denise says, even weirder because he teaches visually. Yeah, so I don't know. This is a total disability that I have. I cannot remember face. And even worst is, if I recall a face, it would be where I met them. If I know where I met them, I can recall them. If they are just got up from there and went somewhere else, I would not know who they are. That is very embarrassing sometimes. And the what I don't forget is the teaching parts. These discussions that I'm doing, I would remember every sentence and word even after 10 years. I still remember when I teach on the whiteboard, if somebody brings up a lecture that I delivered on the whiteboard, most of the time I can tell them at what time, what was the topic I discussed, and what did I draw when I was discussing it. So, teaching part I remember, others I don't. Okay, so Laurie says, you are normal. I have same problem. I think I'm abnormal, and we both are probably abnormal. Uh, Muhaddis Muhaddisa Batul says, Assalamu alaikum, sir. I'm your student. Welcome, Salam. I've taken your lectures. Wanted to thank you a million times for making embryology that much easy for me. May Allah bless you. Thank you very much. I love embryology, and Keith Hill Moore's embryology was the first time I became introduced to embryology, and I love it. So I give credit for embryology to Keith Hill Moore. If I had not read his book, I would not have loved embryology. Okay, so it is beyond 8. How about we break for today and we continue tomorrow? Denise says photographic memory for teaching, like I am with learning. Yeah, so I can remember the teaching part. Every line I draw, every sentence I speak, I remember that. But movies, nothing. Face, I don't. So thank you very much. Please like, subscribe, and share. And if you would like to support this work in which we just talk about things, then you can support it with their 3 links in the description. One is to buy me a coffee, or you can use PayPal, or you can be a patron as well. Thank you very much, and I'll see you tomorrow.